Hello and welcome to our next episode of the Pearl Cruz talk show. I have somebody special with me today on my talk show, my senior in college. Uh, a batch which was probably very vibrant, always quite enthusiastic, competitive, yet very supportive and encouraging to the juniors. So I have with me Anita Lopes, who is board certified psychiatric mental health nurse practitioner, and also she is the news and communications chair of Indian American Nurses Association, Albany. Welcome, Anita. Thank you for being a part of our show.
Thank you, Pearl. Thank you for having me on this show. I'm really excited to share my experience here.
I'm glad we need that. Right. So I was just, wondering, what inspired you to pursue mental health nursing?
Yes. So, as we know, that always emphasis is given on the physical health. But if you look at the definition of WHO, it's always physical, mental, social, and spiritual. But nobody bothers about the mental health. And unfortunately, over years, there has been like an increasing demand for psychiatric and mental health needs of the patients. More and more patients are coming up with issues like anxiety, depression, especially after the COVID. There was a
Mm-hmm.
lot of increase in cases, and I think definitely by being a psych nurse, health provider, I can, like help them and diagnose them and treat them and take care of the needs, which is a real demand now.
Yeah, that's amazing. But did you start as a mental health nurse, Anita? I believe
No.
did you graduate in mental health. Sorry, did you do a master's in psychiatric nursing?
So the thing is that I had done my master's from our college in SNDT, LT, in pediatric
Mm-hmm.
nursing. And then I came here and then I had an experience of working in the operating room. So while I was working, I was also studying.
Mm-hmm.
And I was able to get this degree of psychiatric mental health nurse practitioner through one of the reputed colleges here called as Russell Sage College. And then I graduated last year in May, and then I'm working in like different clinics now as providers.
Mm-hmm.
So it was like a very varied role, like, starting from a nurse, going into teaching, being in administration, being again in the, floor, basically the operating room, and then coming back again. Like, I'm like, hey, I think this is something that I would like to do. I was really inspired by people who were in psych nursing. And when I saw, like, when I was doing my internship and I saw my preceptor and I saw the power and the autonomy that she has, and I'm like, I want that. And I'm like, here we go. So 1 year later, I'm doing the same job that she does. So this is my
Yes,
journey.
I did see online, Anita, when I was trying to Google and research about you, your clinics run almost full. That's amazing. Maybe if I need
Yes.
an appointment, I'll have to wait for months for you.
No, I will squeeze you in. Don't you worry. But anyways, kidding.
So how is a day in life of Anita Lopez as the a psychiatric mental health practitioner?
Oh my God, yeah. So on a daily basis, I have like around anywhere between 10 to 15 patients. It could be like a mix of like intakes and some patients who are coming for follow up. I look at ages from adolescents to geriatrics.
Mm-hmm.
So there are multiple factors that go into taking care of the patient. Basically, their age, the comorbidities, the social factors, um, and what is the affordability of the patient,
Mm-hmm.
and which medications are covered by the insurance, not covered by the insurance. And it's I have like a mix of nice, like mild, I would say, mental health needs to like complex
Mm-hmm.
psych needs, like because I work in sobriety clinic as well, so I have like patients who might just be like having like anxiety or depression, which is like on the simpler side, and to the complex we would be like schizophrenia, psychosis, and all those higher versions which need like more monitoring and which needs like more lab work and all that. So um, I really enjoy this whole mix, and my whole goal is to make sure that I prevent hospitalization. I look into the early signs and take actions so that they don't get hospitalized, and obviously help them have a quality of life. Like, I don't
Mhm.
want to create zombies. I want to have patients who are productive for the society. That's the aim.
That's amazing to hear, Anita. I'm sure you're doing a marvelous job. As a and knowing you as a person, I'm sure you're a person who people would love to talk to and seek advice from. so,
Thank you.
so yeah, coming to then advice. Then, what advice would you give to our nursing students or new nurses who are interested in specializing in mental health?
Oh my, yes, go for it. Like, as I said in the beginning, Pearl, like, that now there is more awareness. Psychiatry was something like that has started like around like 30, 40 years back as a specialization, but now we are having like specialization into like pediatrics, and then we have like adolescents. Like, there are different, like, some people go in addiction and psych. So even within psychiatry, we are having specializations now. Though what I did is like across lifespan, so I can see any age patients. But yes, they must pursue it. And if it is something that they like to do, like, like talk to patients, help them, like have a little bit of therapy, have a little bit of, prescription. And it's more like involving, involving like the whole, like a 360-degree angle, like taking care
Mhm.
of all the aspects. If that is something that you enjoy, you must go for it. I must say that.
And knowing that you've also worked in India for a very, very long time, Anita, do you think something like this, like a nurse practitioner in India, uh, specific to mental health or generalistic to other specialties, uh, do you think this will help in India?
100% yes.
Mhm.
Because when I was working in India, I have seen nurses with great knowledge and skills, but since they do not have the prescription authority, they are falling short of helping the patient.
Mhm.
Like, that's like their hand is falling short. So, oh, if we are preparing nurses who really have, like, the motivation, and who have been there in that specialty for a long time, and they know, like, in and out of that specialty, then it would definitely help. And
Mm.
we know that there is a huge need for medical help in India.
Yes, there
So
is.
we can have this nurse as, like, additional power to help the health needs. Like, it's like a huge need, and we are not doing anything about it. So this is one solution, actually, to
Yes.
involve nurses as providers.
I completely agree. I'm in sync with the, having nurse practitioners because I do see a huge difference here in UK as well. What they may be, they have something called as advanced care practitioners here who
Mhm.
run the clinic. Since
Mhm.
I do hematology nursing, so many cancer care patients and their pathways are expedited because you have the nurses who are running the clinics, the nurses who become like the navigators and the supporters of these patients throughout their journey. And before even the doctors see, I think the nurses are the one who look at the patient and take them through the whole entire journey. And many a times, like so many of my patients would prefer probably giving a call to me or a clinical nurse practitioner than the doctor. They would always find what do you call a solace in talking to a nurse,
Goodness.
because they know that the nurse will hear them out. The nurse is not pressed for time. The nurse is probably going to give some practical advices,
Yes.
because they are so used to working on ground. So I completely agree. I hope when it comes to nurse practitioners in India, people really, really give it a thought and take this up,
And
quite
what
soon.
I have found is, like, if a specialty MD is looking at the patient, he's looking at just that particular system. We
Hmm.
don't do that. We look at the whole patient. So we are like, okay, you're having this symptom, so then tell me, more about this and that, and then here we are giving advice. So the nurse inside, just comes up. And though I'm a psych nurse, I'm like, okay, the patient will say I'm having a sore throat. Okay, so then you can do, like, take lukewarm water, yeah, add salt to it and gargle it 2 3 times. It might reduce inflammation, see how you feel. So that's got to do nothing with my psych, but suddenly the nurse from inside is going to come up and say, okay, stay hydrated. So all these things, which add up, and the patient feels that you care and you genuinely do. That's the difference.
Yeah, I totally agree with you. The holistic thing. I remember this one incident where, I had to get some prescription from a doctor here, and I sort of knocked the door and I said, "Hey, Doctor So and So, I just sorry to interrupt and all." And then there is a patient sitting opposite, and he looks at me and he's like, "Oh, that's you, Pearl." And I couldn't recollect this patient, and uh, I'm like, "Yes, hi." And he says, "Oh, you don't remember me? The other day I had so many doubts about MRI and I wanted to speak to a doctor, but you clarified all of them so much. I never had the need for the doctor." I'm like, "Oh, yes, I do remember." So, yeah, I think sometimes I think I always believe in that. Um, a nurse probably uses everything, the eyes, the ear, the nose, and a therapeutic touch, and that mind, which makes the patient really comfortable and confide in a nurse. And yeah, I completely agree with you, Anita. Hopefully you and I together someday would able to create a change in India and bring this whole nurse practitioner thing implemented and alive in the real sense. Although India has started nurse practitioners, but I think it's not being implemented in the real sense. So that's not going to help.
The other thing that I'm worried about is about the acceptance
Yes.
from the medical council about this decision. I don't know
Mm.
whether there's going to be a resistance.
They better accept that. I don't think people have any choice anymore, because when we
Right.
look at the WHO ratios, we are really falling short. And this whole movement of nurses from India to other countries, I don't think it's just for the money. I always feel it's probably more than the money. It's the environment that they get to practice, the autonomy that they get to practice
Yes.
in international countries, the respect that they get. I think they seek that more than the money that you pay them. So I think it's also, of course, yes, it's part of money, but I think there is more to it than just remuneration for nurses.
I agree.
Uh, so yeah, coming to our next question then, what do you find most rewarding in your work as a mental health care practitioner? I know you have told us a lot of things, but what is that one thing that you find most rewarding, or any story that you would like to share with us?
So overall, I would say like a rewarding experience would be when I have a normal conversation with my patient. I think that's a good way to look at the mental health,
Oh,
because if they
yeah,
are not doing okay, they're not going to have a normal conversation. When the patient is smiling, laughing, talking about the job, that they're happy, talking about the kids, I'm like, well, she's doing good. So yeah, and then when the patient says, I feel so much better after talking to you. I think that is one of the best compliments that I get. I feel so good after talking to you. I think we should do this every day.
that's
Little
that.
things, I'm looking for little things. And or somebody saying that like suppose some patient was supposed to see other nurse practitioner, and sometimes we change patients and they're like, hey, I'm not available, can you see this patient and take this patient in you for your slot? And I'm like, okay, I will manage. And I see this patient, and then at the end of it, please tell them not to change you, I want you to continue. I'm like, yes,
That's
I'll let the management know. So these are like some things, like I'm like, that I feel like my goal is achieved, like I'm making a patient feel comfortable with the treatment, with the way they are, being non-judgmental. That's very, very rewarding.
I yes, and like again I said, knowing a person that you are, I can probably talk hours with you. You can
Oh, thank
you
you.
can hold conversations, make people comfortable, and I'm sure you had that impact as a teacher back in India when you were in the nursing school of nursing, when you were teaching your students. I'm sure many of the students would still be in touch with you,
Yes,
seeking your advice,
yes. I've
and
had good experiences, Pearl. The students used to flock to me. Madam Alia, like, Madam is here. Yeah, so I had that, uh, like that feel that don't run away from me, come to me. Like, I'm here to help you. Same with the students, same with the patients. Like, I don't want anybody to feel scared of me. I feel that we should create an environment where they feel that they're safe, and then they can disclose what they want to disclose and get a solution out of it. That's the goal.
That's the goal. Yeah, that's well said. Well
Yeah.
said, Anita. And I remember as we were talking, don't mind me saying that, but I really like this quote where you put, as students of the college that we are from, you always say, "Kamiti the ami." You know,
Yes.
I sort of, why do you use that quote, Anita? I sort of like it. I know why you use it, but would you like to tell our audiences why do you use that quote?
So I have seen in general, whenever there is like a lot of task that needs mental efforts, physical efforts, time, people like refrain from doing that. Oh, that's a lot of work. I'm already like busy. But then who's going to do it? Somebody has to do it, right? Somebody has to take up the slack. And me and my manager, when I used to work back in the hospital at Cardinal, we used to always say that nobody is doing it. Okay, let's do this. Like, kabhi tithe aami. So, and then once somebody starts, and then people start to join. So you just need to take the initiative and then look for people who are actively, like who are like really interested in doing it. And then you create a team and you go ahead and do it.
Yeah, I think somebody needs to stand up and take the initiative. People just follow. Yeah, you're right.
Yes, yes.
Thanks for highlighting that, Anita. I'm sure the many nurses, I sometimes I feel a lot of our nurses, they're skilled, they're knowledgeable, but I think that just taking that initiative, they're afraid of taking that initiative, I think. And when we speak these things and make them confident in saying that don't worry, just go ahead, take the initiative. We need
Mhm.
people like you. We need people, nurses like you, who are ready to take that initiative, and people will just join in, and it has a beautiful cascading effect to it. Do you have any success story, Anita, to share, where your intervention, probably as a practitioner or as a teacher or as a nurse, also has made a difference in patients' recovery or a quality of life?
Right. So fortunately, by God's grace, I will tell you, Pearl, I have had many opportunities like that. But since we are like talking about the psychiatric mental health nurse practitioner, and it's been, I think, like a year that I've been practicing now. Um, and I work in a sobriety clinic as well. And then I have like two other practices. So this girl I would like to particularly share because she came from another state. She was not settled in this current state, like New York, and then she was looking for a job. Her boyfriend, whom she relied on, with whom she came, broke up with her. There was like a lot going on, and beautiful girl, like into skiing, sports, ballet dancing, um, is running short of money because whatever job she does, she's spending everything on illicit drugs. Miserable when she came to me. And I started her on medication. And then I see her like after 15 days and smiling, very nicely groomed. And she's like, I'm not doing drugs anymore. I don't
Wow.
feel like doing it. I haven't felt like this for years now. What did you give me? I'm like, well, you're feeling good. That's the whole point. So I'm like, she's not doing drugs.
Oh,
The
that's
goal
amazing.
is achieved.
Yeah.
So these are little things, and I'm like, and the whole turnaround, like her motivation turned. She's not crying anymore. She's smiling, and she's like, obviously, situations also changed. Like she got a better job, but I'm saying that overall, when she came, and then that 360-degree, I'm like, this is amazing, and this is what I want to do: put smile on everybody's faces and help them live to the best of their potentials that they can possibly achieve.
That's
I
an
didn't
amazing,
want, yeah, her to waste her life. And like
amazing.
she didn't, I think it was like more like a compulsion for her to go to that to so that she gets her dopamine. But
Mm.
when the medication was given, she's like, I don't feel the need to do it. So
That's
God
amazing.
has been really merciful, Pearl. I'm like, hallelujah.
That's right.
Yeah.
And like you said, I'm sure there'll be so many people who must have,
Yes. There are
improved.
many more like this, and I'm like, I'm really amazed. And I always tell the patients that the medication is always one piece of it when it comes to psych. Like you have to be in therapy, you have to also see what are the other factors that is influencing your present condition. So there are some conditions that we can work on. There are some conditions that we cannot work on because they're not gonna change. So
Mm,
then, okay, what coping skills and strategies can you develop around it? You know. Uh, so I say that medication is important, but then it's a small piece.
mm.
There's more that you can do with the other skills. So a combination of both. It's you have to look at 360. You just can't look at like, oh, the medication is going to solve my problems. That doesn't happen. So you have to
Mm.
work around your life to get it all together.
And how much intervention, the doctors, the psychiatric doctors, have to? What role do they play in So what I'm probably trying to ask is how do you differentiate between a nurse practitioner and the psychiatric doctor, and what is the difference in the role that they play, and how do they help you, or how do you all help them?
Oh, I see. So we practice independently. So the doctor does his job. Yeah, whatever the MD does is the same job that the nurse provider does. There is no difference at all. The
Okay.
only difference will be that in a patient's care, if the nurse provider and the doctor is involved, then the doctor's assessment and his whatever, like the intervention that he wants to do for the patient, would be considered over the nurse provider's um, assessment and diagnosis. But that doesn't happen here. Like most of the times, it's always collaborated. The doctors have a high respect for nurse providers. They consider them like, the teammates. We always talk and come to a conclusion about what to be. So that, that situation doesn't arise, but I'm just saying that in case if there is a situation, then his word would be over the nurse provider's word.
Okay.
That's the only difference. And there is nothing else that I would say is different from being a doctor and a nurse provider.
Oh, so it's basically independent. It's not like you see the patient first and then he or she sees
No,
the
no, no, no.
That's
It doesn't
amazing.
happen that way. Yeah, I'm not assisting him in anything. I'm doing my own thing. He's doing his own thing. And if I have any doubt, I can reach out and ask. And so it was funny because just last week I went to the patient, to the doc, and I was like, I want to do this. And he's like, what do you want to do? I'm like, no, I was actually thinking, he's like, Anita, you can do whatever you want to do because you are the provider. I'm like, okay, I'll think about it. So
Mm.
that way, like nobody interferes in your decision. No.
Absolutely. To some extent, I think I've seen that here as well. I'm not sure in UK they have. I don't think they practice at that level how they practice in US. Like, I don't think nurses practice very, very independently here, because I think the final call is taken by the doctors. But having said that, I do see that a lot of inputs, like in my field of hematology research itself, they will always look up to me and they will say, is this what protocol says, Paul? Do you think
Mhm.
this is how we should go ahead? What is your opinion in it?
Right.
And I feel different. I'm like, they're asking
Yeah.
my opinion. And you feel so nice because they respect you as a professional and they know that you have your body of knowledge and
Mhm.
they have their body of knowledge, and we are collaborators in patients' care. So
Yeah.
that itself is amazing. So I can totally imagine how amazing it must be to practice independently
Yeah.
and advising
It's
your patients
amazing. It's
all by
amazing.
yourself. By your
And I was just happy when the doctor said, I learned so much from you. You do things so better. I'm like, good to know.
that, yes,
Yeah.
that's
We are very particular. That's the thing, like our notes and everything will be like to the T, and you write down everything, the whole discussion, and then put that. And I always say that you have to involve patients in their care. So I never said that this was advice. No, a discussion was held to do this, and then it was concluded that we are going to go with, because it's important that you involve them. Like though they are like psych patients, they are not like, they have their own individual entity, which needs to be respected.
true, true.
Yeah.
So did you have to sort of do a specialized course for a practitioner over there, and how long was that course for?
Yeah, that's the psychiatric mental health nurse practitioner course. It took me 3 years part time
Hmm.
to finish it. I used to work full time and also do on calls and
Hmm.
emergency duties and
Yeah.
study. Got it done, Paul. It done. Yeah. And then
Definitely.
after that, you have to prepare for your boards. It's like a national level exam. And then you clear that, and then you're good to go as long as you know what you're doing.
That's right. So, what's the eligibility criteria for the practitioner program? Do you need to have a master's degree for it?
A BSN. After a BSN or even from an associate, I think there is something called as like a bridge program where you can do directly from an associate to a master's, and sometimes you can also do a BSN to a DNP, like a doctorate in nurse practitioner. Even that can be done. Like there are, believe me, there are so many options here. The
Yeah.
only thing is like you need to be motivated to do it. That's it.
Yeah. So what do you I'm sure, like I said, these are few of the things probably which makes our Indian nurses to really think about going abroad, because they have so many options, so much of flexibility in work, so many other things. That's my opinion. But now, since you have lived in US and worked for so many years, why do you think additionally the nurses move to Western countries or probably even Middle East?
I will tell you, Pearl, moving here was one of the best decisions of my life. I was very well settled in India, and when I left, I think it was like everybody must be like, why is she leaving now? She's like all settled in and, things like that. But when I came here, was this place or was my job like a bed of roses? No, it was not. I had to go back to bedside nursing. I need to do what I had to do. But did I have a better quality of life? Yes. Was I compensated very well for what I did, like minute to minute? Yes. Was I questioned when I was taking leaves? No. Was I supported for my higher education by my working environment? Yes. I was given leaves, never questioned for my personal leaves as well. Like, yes, we are here to support you. And was a loan available from the government for the education? Yes, it was available. So there are many factors, that influence, like, the nurse migrating from India. I'm not saying that, I'm not discouraging people to stay in India, neither am I encouraging, but I'm saying that from my experience, I feel this is, and total, this is my experience. People could have had different experiences. I feel that there is a lot of scope for improvement. And I feel like coming to United States was like helping me to live to the best of my potential. Like, I have like raised myself to what a nurse can really do, like my skill set are being utilized at the best. What else do you want as a person, right? So that doesn't happen in India. Just
Mm,
because you're a nurse, like, she's just a nurse, so nobody's
mm,
going to listen to you. Or even if you have to say something, that doesn't happen here. The doctors listen to you. They always like if you say that this is something that I need to look at, they will look into it, because if that is something that you're bringing to their attention, they're not going to just let it go. So that doesn't happen again in India. Like, बोलती मैं बोलती रही, but nobody listened to me, and then this happened,
mm.
because we
True.
have that intuition and we are more with the patients and we know what's going on. So that needs to be looked into. Another thing that I found was very unique here is like, I don't know whether that happens in all departments, but at least the department that I worked in, the operating room, the surgical director was a nursing background. She would listen to her nurse first. She's like, let my nurse talk. Then I listen to your doctor. I'm like, oh my God, this is amazing. And she'll be like, my nurse says this.
Mm,
So that trust, I never found that in India. And that's just unfortunate. Like, we need to trust our own people, like, because I'm sure that they mean well. So, you need to look at the both sides, which is, I don't know how far we are from that, but I think now the new leaders are realizing that. But then that is something that we must implement, you
do you
know.
think that whatever you said, that the autonomy, the flexibility, the opportunity for higher education, do you think if we make all those accommodations that you spoke about back here in our country, in India, do you think our nurses may consider to stay back and not go to
We
these?
need to also compensate them very well.
Mm,
That's
yes.
another, yeah. We need to raise the standards,
Mm,
like, and that would happen by compensating them well as well, so that they can bring up their standards of life and live that quality of life. So probably they would stay back, right?
yeah.
It's like giving the respect and the compensation both together,
Mm,
hand in hand, and giving opportunities for higher education, supporting them,
yeah.
from the hospital that they're working in and from the family as well, I would say,
Yes. Yes. That's
right?
important too.
And I always found that whenever I went with any kind of concern to my nurse manager, she always listened. She offered me a chair, asked me to
Mm,
sit down, and heard me. I think that's very, very important. And then Sometimes actions were taken, sometimes are not taken. But at least when you feel that you are heard,
Yeah.
that makes a lot of difference. And then there are ways, if you feel that something is not right, you can write up anybody. You can write up a doctor, and you can write up, your coworker. Like, if you feel that that is something that's bothering you, and then nothing was done about it, you can write up people, and then the HR takes care of it, and then they will be sent to whatever, like, anger management or whatever the thing that has happened. So they do take actions. So that's another thing, that you're given that respect, that yes, you as an employee are required here and needed here, and your voice is heard. That's important.
Like, I've seen that happening to some extent in India, Anita. Things are sort of changing over there. It's not how it was 10 years back.
Correct.
Because we've started having nurse leaders who are, more supportive, because they understand, because if they do not support the nurses, it's only going to affect the patient care there.
Yes.
So I think our nurse leaders have also started becoming more verbal with this current situations, I think, and they have also elevated them to a level where they understand not just nursing, but the financial acumen is something that they are also gaining. So they can debate with the hospital management and authorities, saying that by slashing the nursing salaries, you are not going to do any good to anybody. It
Hmm.
will definitely reflect on your patient's poor outcome. I think they are able to link those things up, and scenarios are changing. But yes, I think there's a long way to go, because I think it's not just the battle of a nursing leader there. It
Correct.
has to be the battle of the entire country. A lot of
System.
policy changes, yes, the system. Policy changes have to take place, for nurses to be returned back in the country. Yes, that's a hot topic, but I know if we start on that, we may
We
never
can just go
end.
on.
Yes. Yes, so let's move on to our next section,
Yeah.
which is the rapid fire. And I'm going to probably ask some questions, or speak out something, and whatever first thing comes to your mind, you need to say that. All right.
Mhm.
So, are you all right to begin then?
Okay. Let's see.
All right. So, first thing that comes to your mind when I say nursing school life.
Oh, fun, friends, and mischief.
Oh, you guys were the mischievous batch. Yeah. But at the same time, because when I joined Wokhana Hospital as a novice nurse, I had some of your batchmates as my seniors and team leaders in the ICU, naughty ones. But when it came to working, oh, what diligence in work,
Yes.
what
Yes, that's true.
precision in work, what integrity.
100% on it.
Oh, I learned from them. I will not say the name, but probably I'll message you later. And I admire this person for teaching me. And she not just taught me patient care, but also taught me how to manage the ICU, your inventory management, of course, that time nurses never used to do budgeting and all, but she did give me glimpses of those things, because everything that the nurse uses and everything she ensures that is in place, it's basically preserving and saving, right? So the yeah, I totally agree with your.
Yes.
I have wonderful memories of you as my seniors. Right. The next thing, nursing profession in India.
Scope for improvement.
Yes, yes, there is a huge nursing profession in the US.
Very respectable. I think respect is the word that comes to my mind first. Yes.
Yeah, I think, and that's what's important, respect and dignity that's offered to
Yeah.
people. Advice to nurses in their early career.
Oh, aim high. Never settle for less.
Never said. Amazing. That's the right one. And advice to nurse leaders to promote nursing.
Be kind and compassionate to your own.
Yes. Yeah, and help them grow. Yeah.
Yeah.
One thing you would like to change in the nursing profession if you had the power to do so.
I want everybody to, since I'm a nurse, I want everybody to see nursing through my eyes.
Hmm. And what would they see, Anita?
They would see that we make a difference and that we
Absolutely.
care and that we strive to give them the best quality of life. We are
Absolutely.
there to help and assist.
That's amazing, Anita. and the biggest blessing of being a nurse.
Oh, I can strike a conversation anywhere with anybody. Like it
Yes,
doesn't matter if it's a kid, and I'm like, "Hello, baby, we'll just go there." And then like depending on who the person is, like it's so easy. You can just talk, because
yes,
that's all that we do when it comes to patient care. Like we're talking the whole day, encouraging them, advocating for them, and it comes easy. And I feel like many of the situations can be averted with a simple, like, "How can I help you?" Just an opening statement. How can I help you? So the statement itself makes the person aware, like, even if he's angry, makes him
mhm.
aware, okay, this person is here to assist me. And probably she's going to listen to me. So that de escalates the whole situation there itself. So things like that. Yeah.
I think
I'm
nurses.
very thankful to my nursing profession. I don't think so that I could be, I wouldn't choose any other profession over nursing, because I think whatever I am today is because of what my profession made me. I was a very introvert growing up, and I started talking more to people because obviously nursing needs a lot of talking. We started doing, street plays, and that's where when I started developing my personality, when I was able to speak loud, look at the public, that brought out the real me, and here I am today, just talking away.
Yes, I'm in the profession of talking to your patients. Yes, yeah, street plays. Oh gosh, that is big.
I,
We
I,
could
I
make
love it.
you could make any health song based on a Bollywood song, and I'm sure you would be remembering certain jingles in your mind if you have to recollect. Yeah, but those were such innovative ways of telling people.
People.
We had certain street plays on alcohol de-addiction. I still remember those,
Yeah.
songs.
Yeah.
Now, of course, I'm not going to recite them here. It might sound funny, but yeah, but these were so impactful, over there. I remember this one posting in Malvini where we had, I think I probably said this on the show earlier as well, where we did this whole alcohol de-addiction street play, and there was like I think there were probably more than 100 people, and there was this particular politician over there. He was so amazed and impressed,
Mhm.
and he sort of started, can you do this again? I have my
Again.
assembly coming up the other day, can you do this again for my people? Because he was a guy who really wanted to make change in his area, like I think he was a corporator. And luckily at that time it was also Eid. So I remember he calling all of us.
Oh,
He had
nice.
put like one big shamiana there, calling all of
So
us.
sweet.
What amazing biryani! I still remember.
Oh, I'm telling you, Paul, it's always the small things in life. It's
Yes.
always the small things, the little things that give you most of the joy and the happiness.
Yes, I completely agree with you, Anita. And I hope that, many nurses realize the impact that they make in people's life, and not just nurses. People also realize the impact that they make in nurses' life. I was reading something that you sent on WhatsApp
Yeah.
yesterday. Would you like to share that, Anita?
Oh my God. Yeah. So this was one of my classmates and her mother. So we had just finished our 12th, and I had taken admission in nursing, and then she went on for doing her biochem, whatever it was, like. So when I told her mother, like, that I have taken admission in nursing, and she's like, हमारे में ये सब नहीं करते. तो मैंने
Hmm.
बोला ठीक है, फिर आपके घर में या फैमिली में कोई बीमार हो जाएगा तो अस्पताल में लेके नहीं जाना, क्योंकि यही नर्सेस आपकी सेवा करेंगे.
True.
So that is how nursing is looked upon in India. Now this is coming from like a middle class woman, like how we have different stratas, right, in India. So can you imagine? And that is the general population of India. So they are looking at, like, this is like not a good job, this is like a dirty job, and that's why we don't send our girls to do this kind of job. But hey, it's more than that,
Yeah.
you
It's
know.
more. I know of Indian nurse leaders earning probably better than some of the operating officers or CEOs.
And they
Amazing
deserve it.
figures in salaries, yes. Because unfortunately, that's what defines the status of a nurse, right? Or a status
And
of a person. So
yeah,
yeah. So
and I
if
think
you
at
have
this
it,
point, If somebody tells me like that, I wouldn't react in that way. I might not, because I'm like, hey, I know what I am and I know what my
Amen.
profession is, so I don't have to fight with you for anything. I think that's
Mm,
one thing that I also learned, that as you grow and as you mature, you need to learn to realize what are your shortcomings, accept yourself as a person, and work on those shortcomings if you can. And if there are certain things that you cannot change, then just be mindful of that it should not affect others because of those things. It's important to accept yourself, because if you don't do that, and if you don't have that positivity inside you, you cannot radiate that. You cannot give something to someone if you don't have it
that's well
inside
said.
you, right? So you need to have it first, and then you can share it. um, these are like little pearls of my life, Pearl.
Yeah, well put, Anita. If you don't have something inside you, you can't share it. And I think you're a very radiant, vibrant person, and you're a person who gives hope to others. And I'm very proud to be associated with you, to call you as my nursing colleague. And I'm so grateful that you're one of the nurses who is making a big difference wherever you are. So thank you so much, Anita, for being on our show. It has been a pleasure talking to you.
Same.
Um, there you go, then. Yes, and we will probably, hopefully, in the near future, make a difference to the profession
Yes.
back in our country. I think that's what we are here for, to share the best practices and ensure that nursing becomes more visible in a better way in every country where they do not look up to nurses so very well as in the developed countries. So, thank you
Great.
so much for
Yes.
talking to
Thank you, Pearl. Yeah. Have a good day.
me. Right.